not justify rules being thrown out of the window. We understand that things had to be done fast. We understand that this did not happen only during the pandemic with ArriveCan. It must have happened before the pandemic. Clearly, that doesn't fall directly within the scope of your report, but we want to suppose that, can we suppose that processes were always respected at all times? Well, it's possible that there were some deficiencies before the pandemic. If you look at the report by the ombudsperson looking into larger contracts, larger than ArriveCan at CBSA, clearly there was lack of documentation and some basic requirements were not respected. But I expect a government to use common sense and ensure that there's proper oversight of policies in place instead of simply adding the processes. Thank you very much.
2.5 minutes, please.
Thank you very much, Mr. Chair. I do want to turn our attention now to the Auditor General's reports finding under 1.42, page 11 of the English report. It states that vendors, under the title vendors, we found situations where agency employees were involved in the ArriveCan project, were invited by vendors to dinners and other activities. To the President of the Public Health Agency of Canada, do you or are you aware of any instances where during your time there, before you were the President of the Treasury Board, President of Public Health Agency, and during your time on the Special Task Force for COVID-19 for the very same project under ensuring that people had access to COVID-19 supports. Did you find any instances where this became a red flag, and was that red flag reported?
Thank you, Mr. Chair. We found no evidence that agency employees or staff received invitation from vendors.
Thank you very much for that. To the Auditor General, what instances, or in your words, what situations where the agency employees who were involved in the ArriveCan project were invited by vendors to dinners and other activities? What evidence do you have to suggest that?
As you know, because the files were so incomplete, we turned to emails, which are transitory typically in nature, and it's in those emails that we saw invitations from 3 or 4 vendors to at least 5 Canada Border Services Agency employees and about a half a dozen other that we couldn't tell if they were part of the Canada Border Service Agency or other departments because their emails extensions were not there.
And so, Ms. Hogan, just to clarify that statement, you're not certain as to whether or not officials outside of the Canadian Border Services Agency, which may include the Public Health Agency of Canada, were invited to such dinners or events?
I am not certain. I can tell you that at least 5 of the employees on the emails that we saw, granted we did not see, potentially see all of them, were Canada Border Services employees.
And to the President of the Public Health Agency of Canada, in instances in your own department where an employee is offered gifts or invitations to dinners, are they reported to you or who are they reported to?
Where gifts are offered to public servants, there is a reporting requirement, and there are also conflict of interest declarations that can be filed, but I'll turn to Martin Crummins to speak to the controls.
So as part of the contracting process at the Public Health Agency, we have a form that requires all managers that are proposing a contract to declare any conflict of interest, and that would be the process that they would.
And thank you. I'm afraid that is the time.
Thank you, Chair.
Turning now to Mr. Genuis, you have the floor for 5 minutes, please.
Thank you, Chair. What we've seen from Liberals thus far in this testimony is quite incredible. They're trying to limit witness testimony by moving motions in the middle of their testimony. Liberals are also trying to question the core principle of ministerial accountability. They're trying to suggest that ministers are somehow not responsible for what happens in their department. And this is really unprecedented. I think it's clear that in our system of government, ministers have been responsible for what happens in their departments for hundreds of years, but uniquely Liberal ministers think they're not responsible for what happens under them. Ms. Jeffrey, I want to ask, Canadians I talk to are horrified and disgusted by what happened with the ArriveCan app. Do you think those feelings are justified?
We acknowledge that the governance that should have been in place for an IT project of this nature was.
Sorry. I'm gonna jump in. My time is tight. That wasn't my question, right? My question was: Canadians are horrified and disgusted by what happened with this app. Do you think those feelings are justified?
I think that there were many dimensions to the ArriveCan app. I think that there was value in terms of the services that were provided.
Sorry, do you think Canadians are justified in feeling horrified and disgusted?
I can't speak to how Canadians view the app. I can speak to the governance and the project management that was put in place.
Okay, that's a pretty clear non-answer, but we'll move on. There's a remarkable absence of documents, including records of basic communications that you would expect in a case like this. Did you or anyone else at the Public Health Agency of Canada destroy documents related to ArriveCan?
I have no knowledge or evidence of documents having been destroyed, and we have a policy that requires information of business value to be retained.
So you can't say that they were, and you can't say that they weren't, in terms of your own knowledge of documents being destroyed. Is that correct?
I can say we found no evidence of documents have been destroyed.
Okay, but there was such a glaring absence of documentation. Are you concerned that documents may have been destroyed? Do you think it's plausible that absolutely no records were kept in so many of these cases?
What I can say was it was a time of great change at the agency as we responded to the pandemic.
No, but people still have to talk to each other, right? I know. Ma'am, I know it was an urgent situation and lots was changing, but people still have to talk to each other. People still send emails back and forth. In times of urgency, I would expect there would still be a lot of communication happening, and yet there's such an absence of information. Are you concerned about the destruction of documents, especially with reports alleging Mindone destroying a large number of emails? And I know that wasn't PHAC, but are you concerned about destruction of documents within the Public Health Agency of Canada?
I agree with what the Auditor General has recommended, which is that documentation needs to be provided and to be maintained on file so that when you have change and turnover in personnel, those records are maintained.
That's not really an answer to my question. Can I just quickly flip over to the Auditor General? If you can confirm your previous testimony, the complete absence of documents suggests that either there was a conspicuous lack of records kept or the documents were destroyed, that one of those two things happened, but you weren't able to confirm which. Is that correct?
Well, when documents don't exist, it's either they never existed or they were destroyed. So, and in this case, we can't tell you which it was, but there is a glaring lack of documentation that should be maintained.
Thank you. Back to the president. The app went through 177 different versions, most of which weren't properly tested. You owned the app, so why weren't different versions of the app tested? Why did you not insist on proper testing of the app?
In their testimony that in order to increase the speed by which the versions would be deployed, that they were not all tested.
So you were aware at the time that they weren't being tested, and you were okay with that?
The governance around the project management at the time looked at how the apps were being deployed.
Sorry, I'm looking for clear. Ma'am, I have limited time, and I'm looking for clear answers to clear questions.
I'm going to turn to my colleague Luc Brisbois from the Broader Service.
No. I want to hear from PHAC. Over 10,000 people were falsely sent into quarantine because this app was, in most cases, not properly tested. Are you comfortable with that? And did you brief the minister about the lack of testing?
So it's very regrettable. We're obviously not comfortable when people are erroneously advised. In this case, when they arrived in the country, they were given a green check mark, which means they are cleared for entry without isolation periods. There was then an error in the app that resulted in messages being sent out. The Public Health Agency
I'm asking about the
Genuous, that is
Are
your
you
time.
with the lack
Mr.
of
Genuous,
testing?
that is your time. Turning now to Ms. Yip, you have the floor for 5 minutes, please.
Thank you for coming. As the pandemic evolved, the government continued to introduce new emergency orders in council, and some of which required adjustments to the ArriveCan application. What were some of the adjustments that PHAC had to make?
So there were many adjustments throughout the course of the pandemic, with 83 different orders in council to be specific. One of the key ones was moving to a vaccine differentiated border to require proof of vaccination from people entering Canada. In addition, there were requirements subsequently for testing at the border, and there was a time when the use of the app shifted from being voluntary to being mandatory. Each of the OICs was generally in place for a period of 1 month, and so therefore they needed to be renewed and they needed to adapt to the different situation that took place as we had successive waves of COVID-19 and the entry of different variants. For example, when there were new variants detected globally that we were concerned about, that were variants of international concern, we were able to use the app to determine the travel history of those who had entered Canada to advise them to isolate.
Were these adjustments handled in a timely manner?
Yes, they were required to be very rapid. The entry into force of the orders in council under the Quarantine Act have precise time, and so they have to be implemented exactly in line at the border with the legal force of those OICs.
It was mentioned that PHAC, as a business owner, was focused on deliverables. What is meant by PHAC being a business owner, and how did that impact deliverables?
So as the business owner, the public health agency laid out the public health requirements for the apps. The public health agency was responsible for making sure the appropriate privacy protections were in place, making sure there were legal and other broad policy coordination taking place. We had to define the priorities for the app. We were responsible for maintaining the public health data, storage and use, and for providing support to Canadians using the app via Services Canada.
Can you take us back to the time when this app was being developed? Do you remember what the overarching feeling of the department was? What were you trying to accomplish?
So in March 2020, you'll recall there were border measures being put in place around the world. Canadians were having trouble moving abroad. There was a need to find ways to speed up the implementation of public health measures at the border. The overriding importance at the time was placed on making sure that we had multi-layered public health measures in place, and the border was one of the points at which that was administered. Because of the need to ask additional questions and to have information on travelers' travel history and health, extra time was needed by Border Services officers to ask these questions. This resulted in significant delays at the border, and as we worked to try and find ways to streamline the entry of critical services, goods, and people into Canada, it was very important that we move as quickly as possible to have a digital application that would allow us both to facilitate that necessary travel and at the same time to have the information we needed to model the behavior of the virus and the different pressures on epidemiology and public health that we were going to face to inform future measures. So there was tremendous time pressure, and it was sort of an all-hands-on-deck time when everyone was working as fast as we could to implement the operations.
Do you think the creation of this app would have been handled differently if it wasn't in the midst of a global pandemic?
Yeah, there is no question that we have very detailed, and as the Auditor General mentioned, considerable overlay of structures around procurement. We have IT project gating under the Treasury Board. While many of these requirements were waived given the necessary for the speed of an emergency response, it is also true that we were required to document those measures, and the Auditor General has pointed to the lack of documentation in this regard. And that is something that we have now reinforced in our training policies and procedures, including in our emergency standard operating procedures and pandemic preparedness planning, to ensure that this does not happen again. This was the first time we had faced a global pandemic in the agency's history, and so our processes and procedures have been continually evolving after every crisis, and this one produced quite a number of lessons in terms of our governance and our documentation.
Thank you very much. That is the time. Turning now to Mr. Barrett. You have the floor for 5 minutes, please.
Public Health gave a non-competitive professional services contract to KPMG, and on that, the Auditor General said, quote, "We found no documentation of the initial communications or the reasons why the agency did not consider or select other eligible contractors to carry out the work," end quote. Is that correct, Ms. Hogan?
Yes, you've quoted the part of my report, yes.
Ms. Jeffrey, how much was that contract for?
The original contract was issued by PSPC as one of the 7 companies that were available under the COVID emergency professional services. The total amount that was contracted with KPMG through the 3 different contracts was $4.5 million.
Just the date, please. When was it completed?
I'm going to turn to Martin Cremens to talk about the dates.
Yes, the initial contract, task authorization through PSPC, was awarded and signed on September 29th, 2020, for a value of $518,000.
What was the benefit that taxpayers got from this contract?
Of KPMG in this contract was really to do the work to assess the industry impacts and the traveler journey using the app. So the app had to be deployed in an airport environment, working with air services and the aerospace industry. And so they were looking at the process maps, at the journey maps, at the rollout and other implementation around
So this contributed to the at least $60 million price tag, yes?
The
this contract?
No, the $59 million associated with the contract were related to the development of the app and its technology. So these were
additional
part
costs
of support services related to border measures that included a wide variety of different measures at the border.
So additional costs.
Yes, these are additional costs related to the implementation of border measures.
The Auditor General said that there was no documentation found on the initial communications on this contract. So who called who?
The contract has a sole source justification on file that identifies the expertise of the vendor in aerospace services, in administering public health and health projects at the municipal, provincial, and
So there are
local level.
documents to support their selection?
There is a sole source justification on file, but there is no documentation of the initial contact with the company.
Okay. So who contacted who? It's pretty straightforward. Either KPMG called you or you called KPMG.
There's no documentation on the file. They were chosen from a list of pre-qualified contractors
called
that was
KPMG.
established by the Public Service by Procurement Services Canada, PSPC. So PSPC
Called KPMG.
would have made the initial contacts with those
The
companies.
Auditor
to
General
establish
said,
contracts
and I
with them.
quote, "While the first contract included milestones with clear deliverables and pricing, these were later amended and replaced with less specific deliverables to allow for more flexibility. In addition, the agency did not set out specific tasks, levels of effort, and deliverables for these contracts in task authorizations," end quote. Ms. Jeffrey, did Public Health reduce the deliverables required by KPMG, one of the largest firms in the world? Was there a reduction in the deliverables, yes or no?
There was no reduction in the deliverables.
Okay. I'm going to turn to the Auditor General. Ma'am, your report says the opposite of what the President of the Public Health Agency has just said. And I quote your, should I quote your report again, or you've got, you know what you said. Okay.
I can read it back to you, yeah.
Okay.
No, there were deliverables. The deliverables were then relaxed, right?
Right.
They were very clear, and
Right.
then they were made less specific in order to provide flexibility.
Right. So that's
You got about 40 seconds. Just one.
Okay, so we have the Auditor General. I read what she had written. She repeated what she wrote. What you said, Ms. Jeffrey, is not consistent with that. The requirements were relaxed of KPMG by Public Health, one of the largest firms in the world in KPMG. How is it that the government sets specific criteria, then goes back and creates less specific criteria? So, I would want to know why the government would want to do that, because we know what the result is going to be: higher costs for taxpayers and less accountability for Canadians. How can you possibly justify that?
So, Mr. Chair, what I can say is there was no reduction in the amount of work that was required for the deliverables. Yes, the categories of the work that was being done were broadened, and the Auditor General has pointed out that meant that they were less specific. However, that was done in response to a rapidly evolving pandemic, for example.
Which the Auditor General also said was not an excuse to relax
Mr. Barrett, that
the
is
rules.
your time, I'm afraid. Turning now to Ms. Bradford, you have the floor for 5 minutes, please. Over to you.
Thank you, Mr. Chair, and thank you for the witnesses for being there today. Ms. Jeffrey, the Auditor General has indicated, and you have also identified, that there was no agreement between you, your agency, and Canada Border Services Agency. And so there wasn't any framework or anything like that. Do you have any idea why that was the case, that was never established? I mean, we see the ramifications of that, but what are your thoughts as to why that never happened? Initially, it was PHAC that took the lead on this. So why would they not have been driving the ship on this?
So the Auditor General has pointed to the necessity of having this kind of specific governance in place, and I would say that a letter of intent was established when the app was required to be mandatory in July 2021. Initially, we were working in close collaboration with the Canadian Border Service Agency at high speed, and at the time, a decision was not taken to slow that down, to put in place the governance around it. That is something that we very much regret and have corrected for our future pandemic preparedness and response. It is very important to ensure that the responsibilities, accountabilities are itemized very clearly, precisely to prevent the kind of situation that the Auditor General has pointed out, where each department I think assumed that the other was taking some of this governance and putting it in place. The Canadian Border Service Agency was responsible for the development of the app, and the Public Health Agency of Canada was working to establish the public health measures and guidance and border operations that need to be put in place, and the other corresponding policy, legal, privacy, and other structures around the app's deployment. So while there was a de facto division of labor, that was not codified, and that is something that we have now corrected going forward.
So has PHAC ever had to turn around a project as quickly as they did with the ArriveCAN app when going from manual to digital base? And how long would such a transition normally be expected to take?
So the Public Health Agency has never had to undertake operations of this nature, including at the border. The pandemic required that response. I can't say exactly how long it would take, but there is very detailed and sequential governance around the development of IT projects, and it would normally take years potentially to implement longer-term projects. In this case, they were undertaken on an emergency basis, but there still should have been documentation around that. But the reason that it went forward so quickly was because some of those processes were relaxed given the emergency nature of the deliverables.
So now to Ms. Hogan, has the major problem that you've encountered in this report around the area of lax bookkeeping and record-keeping practices in terms of the ArriveCAN app been of a similar instance in any previous reports that you've conducted? Have you encountered this laxness in any other reports?
Well, definitely my office has seen some similar failures in lack of a governance structure or accurate and timely information. I think it's easy to point to the Phoenix Space System as an example of that. But when it comes to, I think, failures at so many different layers, this is the first time that I have definitely seen this. I think it's more than contracting. It was contracting. It was project management. It was IT management. It was bookkeeping. So I mean, there were so many layers here. I guess the last comment I would make is that it's very common when we look at horizontal projects, when more than one department is involved, to see that the clarity of roles and responsibilities is often a contributing factor, or the lack of that clarity, I should say, is often a contributing factor to why certain horizontal initiatives are not well managed or delivered. So, I would point those to some of the similarities.
And do you believe that the poor bookkeeping and records stemmed from a lack of internal knowledge surrounding the project, or from the high use of external contractors? I agree with the number of departments involved. That definitely complicates everything, for sure.
I mean, in this instance, if you're talking about the record keeping, I think it was the fact that, many individuals, didn't seek, they had many opportunities to seek extra clarity and specificity, whether it be in a contract, in a task authorization, in reviewing an invoice, or the timesheets that went with it. So I think there are many instances when clarity could have been sought, which would have improved record keeping. When it comes to the other aspects, I think it speaks to the need to make it clear at the outset who's going to do what, so that you have clarity around who's going to be accountable for certain steps, whether they should be taken or not taken, and more importantly, accountable when it's all said and done to Canadians.
And that is the time, Ms. Bradford. Maintenant, Madame Secla Desgagnés, 2 minutes 30 secondes, s'il vous plaît.
Ms. Secla Desgagnés, 2 minutes 30 seconds. I'm back with the Auditor General. At the beginning of your report, and I would like to quote you, the agency had the functional responsibility to implement ArriveCAN till April 2022. So PHAC was aware of the fact that there were lots of contracts awarded, and they had to know that contracts had been awarded. Did you find any documentation to highlight the fact that they were aware, for example, that GC Strategies had received about 130 contracts? Did you find any evidence on that? I think you've kind of broadened the question. Contracts awarded to a vendor that did not have anything to ArriveCAN. Well, on that, I don't have any comments. It was clear that at the beginning of the pandemic, the Public Health Agency of Canada had a lot to deal with. So the agency was very small in the past at that time. So they had to seek help from CBSA, and they asked for help for the agency. Asking for help to develop and implement an agency is not proper oversight. So we don't have any documentation. So there was no documentation, no oversight. I know you stated that there was no budget, no timetable, no deadlines, no basic control processes. You have no evidence, for example. And you talked about communication between PSPC and CBSC when it comes to the non-competitive process and so on. Were they the same exchanges when it comes to the scope of the non-competitive process? Was there any information whatsoever on PHAC? There were lots of committees that were in discussion, but as the president testified, they were talking more about health issues. Discussions that were necessary was not about oversight of the project or deadlines or cost. So even though they were responsible for oversight, they were neither responsible for the budget, processes, timetables, or how the taxpayers' money had to be used. They had no concern to find out that kind of information. Maybe there was the concern about that, but there was no trace for any auditor to be able to check. I'm sorry. You'll have another turn.
The floor for 2.5 minutes, please.
Thank you very much, Mr. Chair. I want to turn again to the report, page 15 in the English version, under findings related to no governance structure or budget. The narrative we've heard so far, and the one we've been investigating from the Auditor General, which we thank for her work, is the fact that on the onset of the development of ArriveCAN, we've seen that there was no formal agreement existed between the Public Health Agency of Canada and the Canada Border Service Agency on their respective roles and responsibilities. We find that those roles and responsibilities are critically important because they delineate, of course, things like the project objectives, project goals, project budgets and cost estimates, assessment of resource need, and even risk management activities. This could have been avoided should there have been a good governance structure, at least to have given red flags to this. The president of the Public Health Agency, you mentioned that there was weekly meetings to establish work on ArriveCAN, but it failed to accommodate for any of these really important governance issues. What was discussed, if you can, in just maybe 15 seconds in those meetings?
So at the meetings, my understanding is the focus was on how to operationalize the OICs at the border through the app. So they would go through the different releases. They would look at readiness checklists for the releases. There was a formal intake process for any changes that would be made to the app and documentation of the business requirements for each change. So there was a lot of discussion around the operational rollout of the app and its different versions and adjustments. But what the Auditor General has pointed to is that the overarching project governance infrastructure was not in place or documented.
And I thank you for that statement, because it seems as though that was known to the ministry, or sorry, to the department. Then a letter of intent was established between the agencies, and you mentioned that, to sign on July 2020 and was in effect till March 2022. The letter then clarifies the things that should have been done largely throughout those meetings. And so I was pleased to see that at one point there was a check and balance. We then find non-competitive contracts, however, are then distributed. It is a shame that upon the time that this was caught as an issue, that we almost see this burying of the facts by the release and tenureship of a competitive contract, but your agency was directly involved in ensuring that the experience and qualification requirements of those contracts were very narrow. How is it that that's fair for Canadians when so many times we see the abuse of these kinds of instances take place, and we had an opportunity to rectify that by a competitive process, but then we've seen the terrible issue of ensuring that your department...
Mr. Desjardins, you're out of time. I'm going to allow for a response, though. Mr. Desjardins, you're out of time, but I will allow for a response, please.
The decision was taken to enter into a sole source contract with KPMG because of the time pressures of needing to put in place the actual rollout in the airport processes, the need to liaise with airlines and airport authorities, and the need to ensure that the traveler journey and the information that was being put out to the public about the app was accurate and timely. So the sole source was pursued for reasons of speed of response, and the reasons for choosing KPMG were documented. However, the Auditor General has pointed the need for more documentation in that regard. And so I would say the subsequent contracts also stemmed from the experience and track record of excellent delivery of the vendor on those services.
Thank you very much. Mr. Scheer, welcome. Thank you for joining us today. You have the floor for 5 minutes, please.
Thank you very much. Question for Ms. Jeffrey. You indicated that of the 177 updates to the app, that proper testing for the updates wasn't done. Do you believe that's acceptable to operate in that manner?
A best practice would be to test all of the different applications. However, my understanding is a decision was taken to only test a sampling of them because of the time that it took to test those and the pressure to have the adjustments rolled out quickly.
Okay, who made that decision?
I don't know who made that decision at the time, but
who has the authority to make that decision? Decisions don't just get made; they don't just appear. Who would normally have the authority to make that decision? The
app development and rollout at that stage was being managed by the Canadian Border Services Agency, and the Public Health Agency was collaborating with them in terms of...
Okay, so are you saying it was somebody at CBSA that would have made that decision? Or someone at...
I believe that CBSA has already addressed this in their previous testimony at this committee.
So was it somebody in your department that made the decision to not test the apps?
I'm going to turn to Luc Brisbois from the Border Services Branch.
Yeah, I think the President's right in the context that the governance would have been the place where these issues were discussed, but from an IT perspective...
Nobody knows. We have all these officials who make decisions that impact people's lives, and nobody knows who makes decisions when when the government's going to relax?
I think for the public health agency, the key issue was the dependency on the implementation of the OIC. So things had to be decided, and in the context of this,
every department has
IT
an org chart
would have
with
been
titles
CBSA.
and with names. There's a lot of words going on, but like, who normally has the authority to decide to relax rules or processes?
With respect to the testing or the contracting?
The testing.
Yeah, the testing, we were providing CBSA with the advice of what we needed in the application, and they were running the process.
Okay, so who would have the authority to suspend normal processes or relax rules?
I think it would have been done through the governance of the DGs and the ADMs at the time. We'd have to go back and take a look.
Okay, I'll move on. The 10,000 erroneous quarantine orders, was that a specific event? Like, was there one glitch that created all of that, or was that cumulatively over time, 10,000 wrongful quarantine notices were given out?
So that was a specific event that was identified on the 28th of June and resolved on the 20th of July. So it was a specific event in the app, an error that was identified, rectified, and then the public health agency was involved in addressing that.
Okay, so it was one specific event. Did you brief the minister that this event happened?
I was not present at that time, so I can't actually speak to what briefing, but we can take that away.
Okay. Were the 10,000...
Sorry, that's an open-ended. Are you going to get back to the committee when you say take it back? Is that you're implying you're going to come back to us with an answer on that if the minister was briefed? Because, Mr. Jeffrey, I will remind you that you're here representing PHAC, so I know the questions are you, but the committee hopes you're responding for PHAC. And I heard you say you'll come back to us. Are you going to provide us with an answer to that question?
So I'm not aware of what briefing was done at that time, but I take note of the request and I will go back to see if there's evidence of what briefing
Thank you.
took place
Then
at that
we
time.
will look for that answer. Appreciate it. Mr. Scheer, you still have 2 minutes left.
Have the 10,000 individuals been notified? The Canadians who were ordered, or the travelers who were ordered to quarantine, have they been notified that they were wrongfully ordered to quarantine?
Yes.
Okay. The decision to pursue a quote non-competitive approach in all of this, who made that decision?
That decision would have been taken by the public health agency and to take advantage of the contracting vehicle that was set up by PSPC.
Yeah, individuals, though, like which individuals would have said, we're going to pursue this approach?
I'll turn to Martin for who signed the authority.
There would have been director generals and executive directors within our program branch.
Can we get names and
agency.
Titles?
I don't have those with me at the time, but I can endeavor
Get back to the committee on that. Okay. Was the minister briefed that a non-competitive approach would be taken on this issue?
The decision at the time was taken within the public service at the director general. Is my recollection of the signature of that contract. It would not be normal practice to brief on the nature of how the operations were being implemented.
Okay, so having taken a non-competitive or sole source approach to just not have any kind of comparisons, not do any kind of shopping around to see if you can get a better price or a better product, who provided the oversight monitoring the invoices that were coming in from GC Strategies?
The public health agency did not contract with GC Strategies. I thought you were referring to the KPMG contracts that were administered through the agency. So it would have been at CBSA.
At CBSA.
Yes.
Okay.
That we're monitoring those contracts related to the app development.
Okay. I think that's all I have.
Thank you very much, Mr. Scheer. You have a few seconds left. You did ask for some other information, but I didn't at about the 1 minute mark. Can you just? I do like to get an acknowledgement from witnesses.
The decision makers around the decision to pursue a non-competitive approach. We would like to know who made that decision.
All right.
On the KPMG.
Again, if you could make note of that request and provide an answer forthwith. Thank you. I appreciate that, Mr. Scheer. Turning out to Mr. Chen, you have the floor for 5 minutes, please.
Mr. Chair, we have heard today from PAC that in the initial meetings with CBSA in March 2020, there was a lack of formal governance. The AG's report says that no formal agreement existed between the two departments for the next 15 months. No designated lead, no project objectives and goals, no budgets, no cost estimates, no risk management activities. This to me is beyond comprehension. Section 1.63 of the AG's report, and I quote, a letter of intent between the agencies was signed in July 2021. That to me is 16 months late. In the real world, a letter of intent between two parties is what you start with. I'd like to hear from PAC on what took so long to get a letter of intent signed.
So I can say that the operationalization of the app was done collaboratively between the Public Health Agency and the Canadian Border Services Agency. As I mentioned, we were very focused on the need to stand up the app and to have it rolled out to allow the border to flow and to have the safe restarting of the economy, in addition to the flow of key people. There was a de facto management of the app going forward that was not defined, and that is not a best practice, as the Auditor General has pointed out, and steps have now been taken to rectify that going forward. The letter of intent was developed as the app was moving to move from the voluntary use space to the mandatory space, and that triggered a process to make sure that we had codified and documented the roles and responsibilities appropriately, which is a very detailed exercise that was then conducted. And we acknowledge, recognize, and take as a lesson learned that should be done at the outset of this development in future.
Section 1.70 of the Auditor General's report says, I quote, we found similar issues in the two professional services contracts awarded by the PAC to KPMG. While the first contract included milestones with clear deliverables and pricing, these were later amended and replaced with less specific deliverables. I'd like to hear from PAC. Why would you amend a contract that had clear deliverables and pricing to something that is less specific? That makes no sense to me. What is the rationale for doing that?
So I believe that the intent at the time was to ensure that we had enough flexibility to adapt the requirements to a virus that was changing very quickly and was requiring some expanded responses that we needed to use the services of KPMG to help deliver. As you'll recall, at the time the contracts were initially entered into, we were not sure how long the pandemic would last. We did not know if there would be waves, if those waves would be seasonal. We were monitoring the entry of new variants. And so initially, there was not an expectation, I think, on our part that we were entering into many years of successive responses, and that the responses were being built incrementally. So I think in terms of the need to ensure a continuity of high-quality services, the decision was taken to add some broader categories to the contract. So we take the Auditor General's finding and recommendation that is not a best practice and that we should be as specific as possible to ensure value for money. But I do believe that the decision to create broader taskings was designed to allow for that agility and responsiveness in terms of the work that needed to be done.
So I'm confused. On the one hand, there are initially clear deliverables, and that is in the context of having milestones set out in the first contract. To me, milestones are broad goals of the work that needs to occur for the project. What you're saying is that the flexibility is needed because of the ever-changing needs arising out of the ever-changing pandemic. But the Auditor General continues on and says that, in addition, and I quote, the agency did not set out specific task levels of effort and deliverables for these contracts in task authorizations. So on the one hand, I'm hearing from you that there is an awareness of what's happening around the world, and therefore you are acting and modifying the contract to reflect the changing needs. But on the other hand, we're hearing that there's the agency did not set out specific task levels of effort and deliverables.
Thank you,
I'd
Mr.
like to
Chen.
hear
that is
from
your
the
time,
Auditor
but I will allow for an answer. But that is your time.
Can I hear from the Auditor General
yes,
on
all
this?
right, sure.
Thank you.
Ms. Hogan, the question is for you, please.
So while I acknowledge that the Public Health Agency rightfully needed to make the overarching contract more flexible given the evolving nature, that's where task authorizations then become really important to pull down off of this broader contract when you're asking for something specific. That's when you should be specific with a level of effort, who should be doing it, and the skills that you need. And while creating flexibility in one area still means that you need to provide some specificity for good accountability in another.
Thank you very much. Turn now to Mr. Brock. You have the floor for 5 minutes, please.
Thank you, Chair. Since the release of the Auditor General report, all that we've heard from the Prime Minister and several ministers is that people need to take responsibility. They've essentially put up a firewall between the government and the federal public service, in particular the agencies that are under fire. Now, to you, Ms. Hogan, the Auditor General, was part of your mandate, did it require you to uncover or ask for documentation to show what level of communication existed between the Prime Minister's office, the PCO, and various ministers that we've heard of today and their departments?
So our mandate really is to look at how the federal public service takes action once a decision has been made by a government. So in this case, the decision to enact certain border measures, and then how was that operationalized? In the course of doing an audit like that, we might often see briefing material or so on. In this case, because there was such thin documentation, I would tell you that we saw some emails where the Deputy Minister was being made aware of things at the Canada Border Services Agency, but we saw no formal approval from the deputy there or no formal briefing to ministers. So I can't really speak on what happened between a deputy minister and a minister's
Okay,
office.
and that certainly applies to PHAC as well, that description you just gave?
Yes, we looked for it more at Canada Border Service Agency because they were doing the main contracting
Correct.
and development, yes.
But also PHAC. So, Ms. Jeffrey, I understand you've been in the role as Deputy Minister and President for just 1 year. Your predecessor, who was that?
My predecessor was Dr. Harpreet Kokar.
Okay. And did you consult, for preparing for this particular committee hearing, did you consult with your predecessor on details surrounding the ArriveCan?
No, I did not.
Okay. Was there a particular reason why you didn't?
Because the public servants who are responsible for the administration of this project and the rollout of the app continue to have functions in the department.
Sure, and ultimately you now as the Deputy Minister and President are responsible for the entire department.
Yes.
Right? So you're in a position to answer any and all questions.
Yes.
So going back to my earlier round about communications and the frequency, it sounds like the Minister Haidu in particular, the PCO who ultimately reports to the Prime Minister, were in regular contact with your predecessor and other officials within your department. Now, what I'd like you to produce to us, to this committee, and I'm going to ask it within perhaps 15 days or longer if the chair deems it appropriate, I'd like a calendar or some type of scheduling that would have existed at the time your predecessor was communicating to both Minister Haidu and the PCO. I want to know that frequency. You've indicated that it was fairly frequent. Could have been phone calls, it could have been emails, it could have been actual meetings. I'd like you to produce a schedule of all of those events. Will you do that?
So there was formal governance around the policy of the border measures, and certainly we can document that. But the decisions around the contracting and the governance of
I'm
the
talking
app
about your
rested with the
communications.
public
You
service.
must have some type of system that documents when you're going to have a meeting with a minister. That's a pretty important event. You certainly don't just decide at a whim, I'm going to have a conversation, you don't document it. I'm asking for documentation to show the frequency of those meetings to Minister Haidu and the PCO. Will you provide that?
Is there a particular time period that?
I'm suggesting 15 days.
I think Ms. Jeffrey means time period in terms of the
During the entire implementation of the Arrive Can.
There was a formal governance structure around COVID-19. Are you the specific governance structure around the app itself? I'm sorry, I'm just trying to seek clarification about what aspects of the COVID governance structure are being requested.
I'll make it very, very clear. Any and all communications, whether they be telephone, whether they be email, whether they be in person, surely must have been recorded and documented. I'm asking for proof of that documentation during the entire course of the Arrive Can implementation. This was the most pressing issue in your department and to Canadians from coast to coast.
Just hold on. I might have a point of order, Mr. Is it point of order, Ms. Yip, or
yeah,
is it?
Point of order.
Yes.
This is a really large production request.
So I'm with you. I'm going to let Mr. Brock finish, and then I'm going to interject to try to. I have the same concern you do, Mr. Brock. You got about 15 seconds left. I'm going to try to help you get through this, but why don't you finish up, and then we'll seek to resolve this.
So that's what I'm asking for. What type of documentation would have existed to record communications between you or your predecessor and Minister Haidu and the PCO?
Okay, just let me and. Ms. Yip, if I missed where you are, you can jump in, Ms. Yip, on a point of order. You're really looking for, I think, you don't want, to Ms. Yip's point, communications, you want to know when meetings took place between, yes, okay, so let's focus on that. You kind of went out, it sounded like you wanted to go down the same path that Ms. Hogan had gone on by looking through communications, which is very, very broad. You're talking about meetings and who attended them in the departments that are involved. You mentioned CBSA, PHAC, and PCO.
Correct.
Okay, is that something you'd be able to provide to the committee, the frequency of those meetings and when they occurred?
Yes, the frequency of meetings that occurred with CBSA, Public Health Agency, and PCO in regard to the
okay.
Arrive Can app, yes.
Thank you. I'll turn to you, Ms. You're good with that? That's No, so, you don't expand it, but go ahead.
No. I just want a clarification. Did that include Minister Haidu and the PCO? Your description?
Okay. So PCO was mentioned. Ministerial would be different. So I'm going to let you come back to that because you guys have you have another round. We have agreement on this. Ms. Yip, there is agreement, but you have the floor on a point of order if you like, and then I'm going to turn to you. You'll have the floor after your point of order.
Okay. So, well, first of all...
Is this point of order?
Yeah.
Okay.
Yeah. This is a lot of production documents.
Ms. Yip, I will stop. The witness has agreed to provide the documents. Normally the committee looks for an answer in about 2 weeks, at which point we begin to make inquiries. But it has been agreed to from the minister. So, pardon me, from the witness. So, I need to know what your point of order is.
Oh, well, it would have been better if we could have had this discussion as a committee.
Well, okay, Ms. Yip, you now have the floor for 5 minutes. Over to you.
Okay. Okay, we are over the time at 12.
We are not yet over the time. We started late, and we're still going through it. And it is my intention to get through the full round, which will give our colleagues, the Bloc and the NDP, time after you as well. Then we'll wrap things up in the normal round.
Okay. Although the Auditor General only made one recommendation to PHAC, I'd still like to know if there are any current action plans. What is happening right now? For example, at 1.47, PHAC has stated it will update guidance or checklists with respect to file documentation, noting requirements to document interactions with potential contractors. What progress can you report on this?
Both the recommendations that were made by the procurement ombuds will be completed by next month and are on track. We have taken steps to codify the need for IT project governance as part of our emergency preparedness planning. We have stood up a contract management committee that will have oversight across the agency of all contracts. And we have renewed our training and checklists in terms of the documentation that needs to be provided for contracting and are reinforcing the requirements of the directives across the agency.
So how will these requirements be actually monitored and enforced?
So the training of our staff can be tracked. We will have regular reporting requirements, and there will continue to be internal controls exercised reviewing and sampling contracts.
Okay. And so there is also a review of the current process in place to ensure compliance with filed documentation as per Treasury Board directives on the management of procurement by October 31st, 2024. Why will it take the agency over 7 months to verify that its practices are compliant with the directive?
So what we had hoped to accomplish by that time is the regular sampling and testing to make sure that the documentation has been taking place in the normal course of business on contracts that we're entering into. So that is a requirement by which time we'll have tested the effective implementation of the measures.
So how close are you to this directive in terms of completing?
Well, the requirements are in place as of now, and so we are going to be doing further review and training to make sure that, given the number of new staff that have joined the agency through the pandemic years, have the same level of training and comfort with the directives, and then we are going to be monitoring and verifying compliance with the implementation.
My last question to the Auditor General. After hearing all these questions and testimonies, is there anything else you would add for PHAC?
I mean, if I was looking at going forward, what I'd like to see some of the departments and agencies do is think about how to find a way when it comes to IT procurement to upskill public service. So that while you might turn to a contractor to get a skill that you don't need to employ 365 days a year, you still need to worry about upskilling the public service to be more digital. In that vein, I would encourage departments and agencies to think about things that might need to be digitized, things that are normally done on paper, and so that we're not doing it in an emergency, because the need to react quickly shouldn't be used as a reason not to follow good procurement rules, good project management practices, and definitely good financial record keeping.
Thank you.
Thank you, Ms. Yep. Madame Secla-Degangé, vous avez parole pour 2 minutes 30 secondes, s'il vous plaît.
You have 2 minutes, 30 seconds. Thank you, Chair. I would like to continue my line of questioning started before. I was uneasy hearing you talk about the size of the public service, because even if it's a small organization, there are hundreds of SMEs in the country that are able to prepare a budget with 300 employees and are able to follow up what they're doing. We do agree that the size of the Public Health Agency of Canada did not justify the fact that there was no budget, no follow-up, or that no questions were asked about the development of the application and about who. So your question was because you asked why, and then when I was answering, I talked about the size. I do agree that all these circumstances are just what it is, circumstances. We still need accountability, and the Treasury Board Secretary did give the right guidance to the public service to be more flexible, do things quickly, but still ensure accountability. So why were those recommendations from the Treasury Board not respected? That's a question you should put to the department and to those concerned. Ms. Jeffrey, concretely, you've just heard what we said. I said that SMEs are able to prepare a budget, ensure oversight, and even follow Treasury Board recommendations. Was this mere negligence, or was there a desire to simply look the other way?
In the face of a global pandemic with multiple lines of operation across borders, vaccine procurement, therapeutics, and all the other aspects of public health response meant that insufficient attention was paid to the governance structure of this project, which we regret and which we have undertaken to rectify in future.
30 seconds left. Very well. I think I've heard enough. Thank you. Thank you.
You have the floor for 2.5 minutes. Over to you, please.
Thank you very much, Mr. Chair. I do want to now turn again to the last question I left off on, which was in relation to the non-competitive and the competitive process that was undertaken by the Public Health Agency of Canada in regards to GC Strategies and KPMG. President of the Public Health Agency of Canada, you mentioned that the KPMG was selected amongst a list of vendors that was known to the agency as to the qualification reasons given in answering my question as to why that agency was selected. You responded that it was because of a list of known contractors. Can you supply that list of known contractors and when those known contractors were added to that list, in addition to how long that list has been operating?
This was a global professional services procurement vehicle established by PSPC, and they established the contracts with each of the 7 vendors.
Could you provide that to this committee, please?
Yes.
Thank you very much. And can you also, in addition to that, add the date to which those companies were added to that list?
This is probably a question that I would suggest you ask our PSPC officials, who I believe are appearing tomorrow in front of this committee. The Public Service Agency of Canada was not involved in establishing the list.
Thank you for that. I do appreciate the recommendation. However, it doesn't devoid your ministry or department of accountability when it was your department that was the business owner of this project, and you should have asked those questions to the Public Service Agency of Canada before operating those contracts. And so my final question is in relation to moving forward in terms of the Public Health Agency of Canada's operational work in regards to how it will manage future contracts. I think it's unfortunate that the Auditor General had to recommend such basic levels of qualification for good governance. And I would say those basic levels of qualification are important for me to ask now that you commit to the findings of the Auditor General. And would you also submit to the fact of following up with us in 1 year's time as to how you've implemented these recommendations of the Auditor General?
We have regular reporting requirements, and we will be reporting back on the management response to the Auditor General's report.
And do you have any last, I'll give you 10 seconds just remaining for any final comments you may have to this committee.
My final comment is that I would welcome the findings of the Auditor General's report that while it was an unprecedented emergency response to a global pandemic that had not been faced before by the agency, there were severe operational requirements for urgent response. There nonetheless is a requirement to document and to have in place governance. We have taken that lesson, and while I'm very proud of the response of the agency in terms of the services delivered to Canadians and in terms of protecting health and safety through the delivery of border services, vaccines, therapeutics, and other critical public health elements of the response. We can and will do better in terms of the governance put in place around these projects in the future going forward.
Thank you, witnesses, and thank you, Chair.
Thank you all very much. Mr. Brock, you have the floor for 5 minutes.
Scam boondoggle has to have consequences. It's little comfort to the Canadians who are watching this that you're going to do better the next time, that this pandemic was a once-in-a-lifetime issue. You had all the structures in place and you failed to follow through. Your agency, the CBSA, PSPC, consequences. Apart from Cameron McDonald and Antonio Utano, have you suspended, with or without pay, any of your employees involved in this scandal? Yes or no?
No, there have been no findings of wrongdoing or investigations into Public Health Agency of Canada employees, and no employees have been suspended.
Right. You can only imagine the Canadian taxpayer who are going right now through organizing their taxes, Canadian businesses.
Point of order, Mr. Chair.
Yes, Ms. Khalid.
Thank you, Chair. I'm just trying to figure out how long we are going on this meeting.
Yeah,
I do have other obligations.
Yeah, I'll answer you. We Mr. Brock and then Ms. Bradford, and then we'll end it for the day.
Okay, thank you so very much. Appreciate that.
And you have a classic example how the Liberals want to deflect attention away from this.
Point of order
so
again,
Canadian
Mr. Chair.
Okay,
I was trying to get clarification. I have other things going on throughout my day to support my constituents. I am so sorry. I don't like to be blamed by the Conservatives for just trying to get to my constituents with a sham meeting that we have had right now.
All right, Ms. Khalid, thank you. Mr. Brock, you have the floor for 4 minutes, please.
Businesses and taxpayers are going through the tax process right now. One can only imagine the consequences to taxpayers and Canadian business owners for the shoddy way that your agency, the CBSA, and the PSPC documented their affairs. There would be consequences. The CRA would be levying consequences, if not calling in the authorities to potentially charge individuals. And all I'm hearing is, sorry, we'll do better. That's not good enough. Someone's got to take responsibility. It's clear you, ma'am, as a deputy minister and the president have to assume responsibility. You suspended nobody other than Cameron McDonald and Mr. Utano for speaking truth to power. Ultimately, the responsibility lies with this government. Minister Haidu, Minister Blair, are all responsible for falling asleep at the wheel.
Chair.
And the Prime Minister is the ultimate person who's responsible for this.
Ms. Khalid, what's the point of order?
I'm not really sure why we are naming ministers without having any evidence or proof and blaming them for things.
Ms. Khalid, this is not a point of order. There's a thing called ministerial responsibility in this country. You're well versed in it. As to your previous point of order, you can ask your whip or your committee chair, vice chair, where we are in the rotation. Ms. Yip had asked not 15 minutes ago when we were ending it. I was going to, and I told her. So your previous point of order did look like it was interrupting Mr. Brock, as did this one needlessly. Mr. Brock, you have the floor for 3 minutes. You keep interrupting Mr. Brock. I'm going to keep adding time to him so he can collect his thoughts and begin anew. 3 minutes, sir.
You see, Ms. Jeffrey, I won't be silenced. I speak on behalf of Canadians who demand the truth. Do you agree with me that the ministers and the Prime Minister need to step up and accept responsibility for this mess? Yes or no?
The governance of the ArriveCAN project was managed within the public service, and as deputy head of the Public Health Agency, I take responsibility for its management. Ceding my time to my colleague, Mr. McCauley.
Thanks. Mr. Jeffrey, you made a comment that it seemed to state that the lack of governance was because of everything going on with procuring vaccines, therapies, and COVID, the issues around COVID. But earlier twice you stated it was a decision to relax the governance. So which is it? Is it, as you stated, that it was a specific decision made to relax the governance on this, or was it something else?
So just to clarify, I did not say it was a decision not to relax the governance. I said that the more flexible terms of the contract with KPMG were designed to provide flexibility.
This was about the entire governance, not specifically KPMG. It was about the entire governance of the ArriveCAN process.
In fact,
twice there was a relaxation of the governance.
Mr. Chair, there was not a relaxation of the governance. I acknowledge that the governance was not documented or put in place from the outset of the project. However, that was rectified later as the project was implemented.
So your twice referencing relaxing governance was in reference to what?
I was speaking to the the specific task that the Auditor General referenced in terms of the KPMG contract that she believed should have had more precise milestones.
Then to relax the governance on that specific issue?
To be clear, Mr. Chair, there was no decision to relax the governance around the ArriveCAN app. It was an oversight that was later rectified in terms of
specifically stated 3 times relaxation of governance. Who made the decision to relax that governance?
Mr. Chair, I did not believe I spoke to the relaxation of the governance, and certainly there was no decision that I'm aware of to relax the governance of the project.
About 30 seconds, Mr. McCall.
Okay. The 177 updates to ArriveCAN, who made those decisions to make those 177 updates? Were they driven by Order in Council? Were they driven by PHAC?
The majority of the updates were driven by the changes to the Order in Council as a result of the need to evolve and change the border measures under the Quarantine Act as a result of the evolution of the virus and the public health situation inside Canada.
So mostly driven by OIC?
Pardon?
Or mostly driven by Orders in Council?
Yes, the Orders in Council drove the changes to the app.
Thank you very much. That is your time. Finally, now to close it out, Ms. Bradford, you have the floor for up to 5 minutes, please.
Thank you, Mr. Chair. Question for the Auditor General. You determined that the government did not obtain the best value for money in procuring the ArriveCAN application. What factors did you consider in coming to this conclusion?
So there were many factors. I think I'll list off just 3 quickly. One would be the continued reliance on an external vendor over time, when that is more costly than having the public service do some of the work. So we would have expected that something would have transitioned at some point to the public service. The second would have been that many of the contracts that we saw around GC Strategies and some of the other vendors consistently required the highest level of IT experience. So that experience being 10 years or more, when there was never a good justification for why that was always the level of experience needed. So you would have expected normally in a development project to see many different layers, levels of IT experience being needed. And I think finally I would point to contract extensions, multiple ones that we saw where the dollar value was increased and very, very few instances where deliverables were expanded. So all of those contributed, amongst other factors, to why we believe that the government did not get the best value for money and ultimately paid too much for the ArriveCAN application.
Now, did you look into any other comparable projects in other jurisdictions?
No, we didn't set out to look at what other countries may have done when it came to similar types of apps to control their border measures. Border measures were very different in different countries, or may have changed at different times, and we felt that it was important to focus on what the public service here was doing.
So getting back to the fact that they continue to use outside sources when maybe perhaps they could have migrated to internal employees to reduce the costs and get better value for money?
Yes, Mr. Genuis, a point of order, please.
Thank you, Chair. I wanted to review the record before raising this. This is a very important meeting we're having with the Auditor General. Ms. Calley, during one of her points of order, so-called interventions, referred to it as a sham meeting. I think that's unparliamentary language, and I'm not sure why she considers this important meeting.
No, okay, Mr. Genuis, I would like to get back to Ms. Bradford.
I'm more than happy to comment about this, Mr. Chair.
No, I do not need a comment.
You and I both know, Mr. Chair, this meeting could have happened last week and not during a constituency week.
Oh, really? Well, that is probably not true, Ms. Khalid, since the report just came down. I'd like to get back to Ms. Bradford. If government members have an issue coming in on a recess week, they can speak to their whip and seek reassignment. Ms. Bradford, you have the floor, and I'll give you extra time, up to 3 minutes, please.
So how might the government reduce the reliance on external resources in a relatively short period of time while a project is ongoing?
Is that directed at
yes, I was
Chair?
continuing my question with you.
Well, here we were looking at the whole time between the development of the launch of the ArriveCAN app, which was in early 2020, all the way till January of 2023. That's a few years' time. So I acknowledge, given the need for the assessment that was done by the Public Health Agency and the Canada Border Services Agency at the beginning, that they didn't have the skills and also the capacity at that time to do it. I would have eventually expected to see a transition in order to reduce that long-term reliance on an external vendor. Aspects like maintenance